Did you know that the health of your gums could impact your heart? Recent research presented at the American Heart Association's 2026 conference has revealed a fascinating link between gum disease bacteria and a serious heart condition called calcific aortic valve stenosis, or CAVS. This discovery is changing the way scientists and doctors think about oral health and its role in overall wellness. Today, we'll explore how bacteria from your mouth might influence your heart and why taking care of your teeth could be more important than you ever imagined. Calcific aortic valve stenosis, or CAVS, is a condition where the aortic valve in the heart becomes thickened and calcified. This restricts blood flow from the heart to the rest of the body. In its early stages, CAVS might not cause any symptoms, but as it progresses, people can experience fatigue, chest pain, shortness of breath, fainting, and even heart failure. In severe cases, the only effective treatment is valve replacement surgery. Understanding what causes CAVS is crucial for prevention and better treatment options. Gum disease, also known as periodontal disease, is a chronic infection of the tissues that support your teeth. It's caused by bacteria that build up on teeth and gums, leading to inflammation and over time destruction of gum tissue. But the effects of gum disease don't just stay in your mouth. Scientists have long suspected that oral bacteria can enter the bloodstream and affect other parts of the body, including the heart. This new research provides more evidence for that connection. The main culprit in this story is a bacterium called Porphyromonas gingivalis, or P. gingivalis for short. This bacterium is notorious for causing gum inflammation and tissue destruction, but its influence doesn't stop there. P. gingivalis has also been linked to systemic inflammation and an increased risk of cardiovascular diseases, including plaque buildup in arteries. In the new study, researchers found significant amounts of P. gingivalis in the calcified aortic valves of patients with CAVS. To uncover the connection, researchers analyzed cardiac valve tissue from patients undergoing valve replacement surgery. They compared samples from people with CAVS to those with other valve diseases. What stood out was the higher presence of P. gingivalis in the calcified valves. This unexpected finding prompted further investigation into how this bacterium might contribute to the development of CAVS. Dig deeper, scientists turned to animal models. They exposed mice to live in heat inactivated P. gingivalis to see if the bacteria would accumulate in the aortic valve and cause calcification. Some mice were also given antibiotics, while others had a specific inflammation pathway genetically disabled. The results were clear. Repeated exposure to live P. gingivalis led to more bacteria in the valves, increased calcification, and symptoms of aortic stenosis. Preventive antibiotics reduced these effects. Key discovery was the role of inflammation. In the mouse studies, P. gingivalis activated a protein called interleukin-1 beta, or IL-1 beta. This protein is produced by immune cells and is known to spur inflammation. When researchers genetically deleted IL-1 beta in mice, the harmful effects of P. gingivalis on the heart valves were significantly reduced. This suggests that inflammation is a major driver in the development of CAVS linked to oral bacteria. This research is important because right now, there are no medications proven to prevent or slow the progression of CAVS. The only option for severe cases is surgery. By identifying a possible link between gum disease and CAVS, scientists hope to inspire new preventive and therapeutic strategies. If oral health can influence heart valve disease, then maintaining healthy gums could become a key part of heart disease prevention. But oral hygiene isn't just about having a bright smile. It's about protecting your overall health. The study's lead author, Dr. Chenyang emphasizes that taking care of your gums and treating periodontal disease may have benefits beyond your mouth. While it's too early to recommend specific treatments for preventing CAVS, the findings suggest that oral health is an important piece of the cardiovascular health puzzle. Dentists play a crucial role in early detection of health issues. For many people, regular dental visits are their main connection to the healthcare system. Dental professionals can spot signs of periodontal disease early, which may lead to quicker referrals and better health outcomes. The American Heart Association's Healthy Smiles, Healthy Hearts TM initiative is helping dental teams educate patients about the connection between oral and heart health. It's important to note that this study has limitations. The findings have not yet been confirmed in people, and more research is needed to fully understand the connection between gum disease and CAVS. The researchers have already started a clinical study to further evaluate this link. As science advances, we may learn even more about how oral health impacts the heart. This study adds to a growing body of evidence that oral health and heart health are closely connected. Other research has linked oral bacteria to plaque buildup in arteries, coronary artery disease, and even cognitive function. The mouth truly is a gateway to the rest of the body, and keeping it healthy can have far-reaching effects. So what can you do to protect your oral and heart health? Brush and floss daily, visit your dentist regularly, and seek treatment for any signs of gum disease such as bleeding gums or persistent bad breath. These simple steps can make a big difference not just for your smile but for your heart as well. Researchers are now conducting clinical studies to confirm the link between gum disease and CAVS in humans. If these findings are validated, it could open the door to new preventive strategies and treatments. The hope is that, one day, keeping your gums healthy could be a standard recommendation for protecting your heart. In summary, the connection between gum disease bacteria and calcific aortic valve stenosis is a reminder of how interconnected our bodies truly are. Oral health is not just about teeth, it's about your heart and overall well-being. As research continues, one thing is clear: taking care of your mouth is a simple but powerful way to support your health for years to come.